So I will be refuting the policy claim that terminally ill patients should have physician-assisted suicide. So the advocate started off by saying in one of the secondary claims that a lot of people have terminally illnesses. He just says a lot, and that's a really broad term to use. He didn't. I'm sure if we all take a vote right now in this classroom, no one will raise their hands to say they have a terminally ill disease. So how can you quantify a lot in a broad sense when there's over 1 billion people living in the United States? And I'm sure less than 10% of that would have a terminally illness. The advocate said that terminally illness is very painful. According to this article on physician-assisted suicide in the New England Journal of Medicine, it states, "We recognize the obligation of physicians to respect a patient's refusal of treatment, to relieve pain and suffering, and to provide palliative care. However, we believe the art of healing should always remain at the core of medical practice, and the role of healer involves providing patients with hope and renewed aspirations." So there is medicine that can be used to relieve this pain. It is up to the patient to refuse this medical treatment. And also in the same article, medical doctor Donald Bowdrew and Margaret Somerville said, for palliative care to remain a healing intervention, it cannot include therapeutic homicide. Euthanizing and healing are intrinsically incompatible. Involvement of physicians in such interventions is unethical and harms the fundamental role of the doctor as healer. The advocate also said they have no reason to live. In the same article, supporters of physician-assisted suicide justify their position by placing the value of individual autonomy above all other values and ethical considerations. Giving individual autonomy absolute priority runs roughshod over competing values, protections, needs, and ignores the harmful effects on other people. In the third point of the advocate says, making physician-assisted suicide legal would be beneficial. So, beneficial in regards to the patient who is terminally ill. And the advocate also said that laws preventing us to help there are laws preventing us to help these patients. The advocate also stated that there are 5 states which totally help the patients, saying that there were 5 states, Oregon, Washington, California, Montana, and Vermont. And according to what the advocate said, this is false because there's evidence showing that there is help for patients, but the advocate says there's laws preventing us to help these patients.